Good evening, I'm Alicia Richards.
I'm Valerie Pritchett. Thank you for joining us. Well, childhood vaccination rates across the country and here in the Commonwealth are declining.
Experts are now warning of potentially life-threatening consequences. Our Sarah Wilson joins us with our top story now. Sarah.
Alicia, Valerie, vaccination rates for diseases like polio and the measles were actually on the rise up until 2020. Then they started to decline. Experts say there's a pretty obvious reason for that. Declining shots and rising fears. More and more parents are opting out of vaccinating their kids.
Overall, vaccine rates have dropped about like 1% nationally, which doesn't sound like too much, but it's actually pretty huge.
Here in the Commonwealth, it's a similar story. Statewide data from the Pennsylvania Department of Health shows vaccination rates for preventable diseases like polio and the measles has fallen over the past 2 years. That's the case for most of the mid-state too.
Measles, mumps, rubella, because it's a combination vaccine, but measles specifically, but all of them are very contagious. So the less people that get vaccinated, the more likelihood that we are going to see these types of viruses spread.
And that fear is becoming a reality.
Measles itself has been increasing significantly. There's about 49 cases in 2021, and then we had 118 last year.
The same goes for polio. The disease was deemed eradicated in 1979, but New York State saw a case last fall.
There's some people who cannot get vaccinated due to medical reasons. So it leaves the people who cannot get vaccinated even at higher risk because they rely on the rest of us to protect them.
Health experts say the reason for the decline in vaccines is likely linked to misinformation.
We are also having, a decrease in attendance for routine office visits where we typically talk vaccines, talk education, and get children immunized.
They're urging parents to learn.
It really is keeping not only your family safe and you safe, but your community safe as well.
Even if your child missed the standard age for a vaccination, experts say it is still safe to get them one. Overall, though, healthcare providers continue to emphasize that the best thing you can possibly do is talk to your doctor if you have questions, because they're the experts when it comes to any concerns. Valerie?
Thank you, Sarah.